These are the Joint Jack Chronicles, and this morning we're going to talk about the efficacy of hand wrap, which is a part of every hand dressing. If I were to wrap my hand with a gauze of any kind or a dressing, all of the load would occur on the ulnar aspect and on the radial aspect, and the pressure would be all here on the sides of the hand. And just as my glove is doing, there would be no pressure in fact, there'd be an absence of any contact or pressure in the palm, which is where you'd like your dressing. So the principle behind a hand dressing is to build up the AP diameter until the AP diameter exceeds that lateral diameter for any particular hand. In this case, we'd probably use 1 on the front, 2 on the back, and then comes a wrap. If you use an ACE bandage, ACE bandage is elastic. It tends to tighten with time. It can create edema in the hand and the tissues. It can even act as a pre-dystrophy phenomenon if it's tight enough. It tends to tighten over a period of time and can even produce edema and problems with the intrinsics locked in their compartments between the metacarpals. In most hospitals, they have some bias cut stockinette. It is a thin, filmy material, which when you put it on, tends to loosen very quickly and does not hold the pressure you apply. This is what we call hand wrap. It's a specially woven material that has a tension to it that will let you put on a dressing pressure which will stay the same over even a 2-week period while the dressing's in place. There's a little green dot in the corner. That is indicative that it's been inspected, and it also serves the purpose that if the hospital tosses a roll on your table, if it doesn't have a green dot, it's some of the inferior material, and Holmes, there's treachery afoot. In any case, we wrap the hand with the gauze, the hand wrap, which will hold this in place, and add one on the back with a little gauze between the fingers so we prevent skin contact, and a dressing which comes out over the tips of the fingers. And the pressure I'm applying can be a good deal more if you're worried about some bleeding in the palm. But this would be essentially a dressing that we might use for a carpal tunnel syndrome. If you look at the hand from this view, you see that the hand width between my thumbs is pretty narrow. That's about what it was. If we turn that 90 degrees, you see that we've built up the AP diameter to exceed that, so that all of the pressure, which has been applied by the hand wrap and will be maintained at exactly that pressure over time, is applied in the anterior and posterior for position or load areas of the hand. And essentially that's what hand wrap does for you, and there's not any other available material which will do what it does. Thank you.